Figuring out the appropriate treatment for polycystic ovarian syndrome can often be quite challenging. A lot of patients I find, for personal reasons or personal preferences or adverse effects from previous treatments, find there's often a limited number of treatments available for them in trying to help manage a lot of the symptoms associated with PCOS. Another main challenge with PCOS treatments is oftentimes the screening and treatment for issues that arise with PCOS often have this tunnel vision. And I've mentioned this previously very often, this tunnel vision where we're just looking at treatment of the reproductive organs or pathologies that could affect the reproductive organs. But PCOS, because of its high risk with several comorbidities, is essentially a systemic condition. So we see with polycystic ovarian syndrome, there's also an increased likelihood of having several cardiometabolic issues, such as high cholesterol, potentially higher blood pressure, diabetes. We see there's often chronic low-grade inflammation with polycystic ovarian syndrome, as well as increased oxidative stress, which if you're trying to conceive can be harmful and have some negative impact there as well. And we often see that there's increased risk for certain mental and emotional disorders as well, such as anxiety, risk for depression, and there's potentially a link between PCOS and increased likelihood of some neurological disorders as well that's currently being investigated. And we know that PCOS is also associated with a higher risk of miscarriage, pregnancy loss, and infertility. So when we're looking at treating PCOS, we'll see patients that have different requirements, different needs, because they're at different stages of their life and they have different personal preferences. So patients that aren't looking to try and conceive are often told they don't need to worry about PCOS. If they ever decide to have children or want to conceive in the future, then they should look at, what treatments can be done. And this will often put patients with PCOS at a health disadvantage because they will just suffer with a lot of these comorbidities and the health issues and things like fatigue potentially, and that long list of symptoms, and essentially nothing may be done for that for many years. And I'll often see patients that are very young, like in their mid-20s, late 20s, that are already having high cholesterol, signs of diabetes, symptoms of diabetes, and we can diagnose it as well, or subclinical hypothyroidism. So it requires kind of a wide net to make sure we're figuring out what's affecting each individual with PCOS, and that can vary from patients with PCOS. They can present very differently for each individual. So I love sharing studies on additional evidence-based treatment options because I find it just opens our mind up to potentially alternative treatment options that have documented efficacy and a therapeutic effect. And the variety is very important because some of these treatments may better fit, what is appropriate for certain patients with PCOS based on personal preferences and personal needs. So a new review that looked at a very important mineral called selenium. Selenium is an essential mineral for our body that's used for a wide range of purposes, from its role in the immune system, supporting antioxidant activity, potentially cardiovascular health as well. And so with PCOS, they found giving additional selenium to patients was actually documented to increase antioxidant activity. They saw improved insulin sensitivity. They saw reduced levels of triglycerides and total cholesterol. It was actually able to reduce fasting plasma glucose levels. And when we think of selenium, because of its wide use or wide needs for overall health, going over simple things like selenium is such an easy variable and potential treatment to make sure we're covering with PCOS patients as well. Now, will selenium be the solution for PCOS? I generally do not think so on its own as a monotherapy, but I do believe that it has potentially a very important role as a part of a more comprehensive treatment plan. Nonetheless, I love sharing research like this because I find it's just very interesting how certain things have been documented to help with PCOS, but we rarely talk about it. And I for sure haven't seen anyone with PCOS come in for a consult where a healthcare provider previously covered the importance of making sure they're getting enough selenium in their diet and its role in potentially managing a lot of the consequences associated with PCOS as well. And it is important to mention that selenium, while an essential mineral and has very important functions and may be beneficial for certain health conditions like PCOS, like we saw in this review, but you also want to make sure you're not getting too much selenium. So every nutrient will have something what's called a recommended daily allowance. So this is an amount of a particular nutrient or mineral in this example that will meet the nutritional requirements of almost all healthy individuals, upwards of 98% of healthy individuals. And the recommended daily allowance for selenium is 55 micrograms. And keep in mind, selenium will be found in certain foods in your diet as well. So before you consider taking any supplement for anything, including selenium, it's always important to chat with your healthcare provider because you want to look at, is the amount of selenium you're taking still within what's a healthy range? Is it excessive? What are the potential risks and harms of taking a supplement at a higher dose? Is it contraindicated with some of your health conditions? Is it going to interact with some of your medications or other supplements? And making sure that it's being used under medical supervision as well. So before you take any supplement, including selenium, make sure you have a healthy conversation with your healthcare provider about its potential benefits, its potential risks, and to determine if it is an appropriate treatment to be included as a part of your more comprehensive treatment plan.